So it's a full 15.
Okay.
You want to start?
Yes. Hello, my name is Van.
Hi, I'm Emma.
I'm Gianna,
And I'm Lily.
and this is our roundtable 2 discussing the musculoskeletal health and ecological study assessing disease burden and research funding.
Right. Overall, what did you guys think about the article?
I thought it was really interesting. And well, the first thing that caught my eye was like its main objective of finding the correlation between like funding and the musculoskeletal burden, diseases of burden, and like how it affects the quality of life.
Yeah, I think like something that definitely surprised me was like I never realized how much musculoskeletal disease like impacted the general population. Like the way they like discussed like the facts of like it's the one of the leading causes of it's a leading driver of healthcare spending, which I did not realize.
Oh, yeah.
It says an estimated direct cost of 380.9 billion, which exceeds diabetes, cardiovascular diseases,
Yeah.
mental disorders, and cancer, which like is crazy to me because I feel like in this like time now, I feel like it's so much like cancers everywhere. And I always thought that would be like one of the leading things, or cardiovascular diseases. Because like heart, like cardiac arrest, heart
Yeah.
attacks are like so like one of the leading causes of like deaths, I
I
thought.
feel like you don't hear a lot.
Yeah.
Musculoskeletal.
No,
It's
I
like not something you hear about all the time. And it affects like 1 in 3.
That was a
Like,
lot. And
it's
also
crazy.
the disability aspect too is like it's a leading cause of the disabilities, which
Mhm.
also like doesn't just like affect people's like quality of life, but also it's a fact of like that affects our economy because it has to do with like the working force. Like there's a ton of people who have to get driven out of
Yes.
work because of their disability, which also like just I don't know. It's crazy to think that people just can't work because of this disease that they have.
No, I agree. It also like it made sense to me when I read like it mentioned that like America is an aging population. Like so many people are getting older, like comparatively in our population of like younger people to older people. We have a huge aging population. So that's why it like affects so many people out of all of us. And the fact that like there's no specific cure or like technically like a specific treatment that fixes it makes sense why like there should be more funding towards like researching prevention and treatment for it.
Yeah.
Yeah.
And what you were saying about the age spread I have here, it's like composed 2/3 of the prevalent cases are aged between 10 and 74.
And that's
Like
a
that is a
huge
huge
yeah.
spread.
Yeah,
Like, I don't know, that's insane to me.
yeah.
And I think, sorry,
No, you
for one of our infographic, we can do the call to action and just talk about the funding and how it does not have that much funding.
Oh, yeah.
Like how many people it impacts. And how many people it impacts too.
No, for sure. I agree.
Especially with the aging population, because like our healthcare is getting better, people are living longer.
Mhm.
There's like, they're focusing more on like diseases that cause death.
Yeah,
versus,
that was
like,
another thing
diseases that
too.
cause
Yeah.
disability. I feel like that was a really big point in here.
And like with that,
Yeah.
one of like the themes I feel like of this article was like the quality of life versus the quantity of life. Like
Yeah.
what you were just saying of how people are, they're focusing on not dying, like the mortality
Yeah.
rates,
Yeah.
but instead they're not realizing like, okay, yes, you're preventing death, but then you're also, in a way, you're kind of
You're giving them like a
elongating
longer
stuff.
life, but
Yeah.
not.
But it's like, it's not a good, because you
Yeah.
have more
Yeah.
disabilities, you have more pain. It's just longer lasting, getting dragged out.
Yeah, like it mentions in the article, I remember
Yeah.
like that was a surprise for me when it mentions here in the introduction, it says global health morbidity has shifted in recent decades from communicable, maternal, neonatal, and nutritional diseases to non-communicable diseases. So it's like there's death rates are declining, but non-fatal injuries like the musculoskeletal injuries are becoming more of a significant concern.
Yeah.
It says like childhood illness and infectious disease to there's a shift in disease burden from childhood illness and infectious diseases to unhealthy adulthood. It's like more people are suffering in adulthood rather than like, you know, years and years ago when it was like more like the disease would kill you like when you were a little
just
like
done.
It's like
child.
more people living in pain.
Yes.
And just like dying.
Yeah.
And it also says the disease of burden is increasing defined by chronic conditions rather than premature mortality.
Yeah.
Yes.
Yeah,
Yes.
exactly. And that's why I think like this article is definitely like important and specifically like better to look at compared to our other articles because it says they did a comprehensive analysis of NIH funding across 60 matched diseases.
Yeah, the
Yes,
60
yes.
was.
So
So
like,
they had to
wrote
choose
that.
the 62 that they think
Mhm.
that would be
I feel
best.
like
best
a
for
lot
them.
of the infographics were like really helpful to see too.
yeah,
Like all of the
Yeah.
The
dot plots
graphs,
and
the
like
visual, like,
percentages. And
Yeah.
all
yes,
the-
when they looked at the funding comparison, it
Mhm.
says they bridged the gap between disease burden data from GBD in 2019 and NIH funding patterns specifically for 2019 and 2021.
Mhm.
So
Mhm.
that helps look at like the implications for policy and practice.
Yeah.
Because their whole point was like they want to adapt and address the emerging health challenges efficiently and
Yes.
effectively
Well,
because
so-
it's changing.
100%, and that's just how, like, musculoskeletal diseases they can include arthritis, like back pain, neck pain. All of that is like super common. Like you can talk to anyone, there's like, oh yeah. But it's just, doesn't seem as significant to these like big research funding because it's like, oh, it's not gonna kill them. Like
Yeah,
it's
I
like
just
not
think,
like a
oh.
disease that's just like, you
Yeah.
have an expiration date. It's just like, oh, it's just getting long. Like, oh yeah, you're in pain, like here's some medication to kind of help. Like there needs to be a better
Yeah.
system funding to like research how to prevent or like
Like look into the genetics. of it.
exactly,
Mhm.
exactly. Which I think we can, for one of the infographics, we can probably talk about that too.
Like
Yeah.
genetic research and things.
Yeah.
Mhm.
I know they also talked about like putting money towards like therapy, like different.
Oh,
yeah,
yes,
different like
I've seen
therapy
that.
ways or
Yes.
for like the kids that, since it's not as prevalent in children, there's like no ways to like treat that besides using
Yeah,
like
I saw
adult
that.
treatment measures.
Yeah.
So there was also a big chunk
They
of
did
that.
have a big chunk of
That
Yeah.
was
the
like, oh,
pediatrics.
if
That
there's
is
money, like
aspect.
more money, it should go towards.
Yeah, I was saying how difficult it is to get funding, especially for like a youth like
Mhm.
treatments and different ways to help them with their
Because a
musculoskeletal
lot of the
diseases,
big
'cause
like
it's not
drug companies don't want
as,
to
Yeah.
like research towards that when they could be
Because they
putting
could
it
just make
towards
money
like
towards
cancer
painkillers.
or things like
Mhm.
that, where they can make more money.
Yeah, exactly. And this is like, I feel like it's scary, like looking at this because it does relate to us, like even now and like later in life. I don't know, for me, like I feel like it reminds me of like my life and like the lives of like us because like it's so easy for this to like happen to anyone. Like I know my mom, like a few years ago got in a bad car accident, like a truck like rear-ended her. And she like got really bad neck pain. Like she was going to the chiropractor for a really long time and like therapy and stuff, but it never like fixed it.
Yeah,
Like
and
she's
it just
still,
like helps ease the.
yeah.
It eats it, but it
And
doesn't
I
help.
literally think it like made it worse. Like
Yeah.
eventually my mom thought the chiropractor was like working, but then she had a bulging disc in her neck
Oh,
and like
no.
narrowing of her spinal canal, which like that definitely wasn't caused by the
Yeah.
accident,
No,
but like
but-
the bulging disc, I feel like the chiropractor could have made it worse and like she had to get surgery and
Oh,
everything.
wow.
And I feel
That's
like
so scary.
Yeah.
if there is like more research going into this, like that's so easy for like imagine anyone getting in a car accident, like so quickly you could
And
have
that's
back
common
pain,
too.
neck pain, like those are all the musculoskeletal
And you're just stuck
diseases.
with it for the rest of
And
the
there's
day.
no
Car
like
accidents are
cure,
common.
there's no like specific
No.
like treatment that fixes it. So like this is something that like will eventually affect like almost all of us. Like
Yeah.
when you get old enough, like by that point, like sometimes my back already hurts and I'm like,
Exactly,
I'm
I'm
just
like,
like,
oh
oh, no.
God, like what am I gonna do?
And
I
even
think-
in the like the graphs, the age
Mhm.
groups, like, what is it, 55 to like 70, it's like 15 million-ish
Oh,
like
gosh.
prevalent
Mhm.
cases, so that's a huge chunk of like our population.
And I think it not only affects like your physical health and pain, it affects your mental health
Mhm.
I
too.
was just about
And
to
it
talk
was,
about
yeah,
that,
talking
yeah.
about like people with MSK orders lead to mental health decline,
Mm.
risk of developing like more diseases, so
Yeah.
it's like a ripple effect.
And with that too, think about with the mental health like disorders, like if they're already going through like the skeletal stuff and then you add on the mental health, like that's its own category as well.
Mhm.
It's like part of my thing was just like hypothetical, but like if we put more funding into like these musculoskeletal diseases, do you think that would end up
Like,
preventing
decrease the
less
rate of-
cases in the
Yeah.
mental health areas? And then would that then require less funding because it's like, oh, we're preventing
Or-
stuff.
pushing that kind of.
Yeah.
Yeah, I definitely think
preventing
it
It's
more
like
than
a
one
way off
thing,
in a way, yeah.
More than one.
Cause
thing.
it's just like a domino effect, like
Yeah,
it
it
just ripples
is.
down, like you start
Yeah.
with this, it's gonna lead to this, to lead to that, and like, why keep putting research into all of these when we just
If
hit
you
the
put
base
more
ones?
into one, it could kind of. That's what I think was like a big thing, because there were, oh, it affects economy, because people aren't working, and then
Mhm.
people are like you know, they can't work, they can't do things that they used to do, so their mental health declines, and like that can lead to being like susceptible to a lot of other diseases, so I think
Mhm.
if they reallocate like some of the money, putting more towards musculoskeletal, that could like ripple effect and decrease the
Yeah,
rates
just
of a
think-
lot of different.
With the disabilities too, just thinking about people out of the workforce, like just the effect of the economy, like people are living off the disability checks and
Yeah.
like
Yeah.
that's their only way of living is
Yeah.
because they can't work because of this disease that they have that's uncurable. Like there could have been things to prevent it. Like we don't have research in there. We can't get those areas.
No,
I think my biggest question is like where the money's coming from. I know it said like taxpayers, but like
Mhm.
majority where the money, how could people start funding? How
Yeah.
like distribution wise?
I know I remember reading like that it came from taxpaying dollars or something.
Yes, so like.
Yes.
Yes, I think that's what it said in, one of the things that it said that we should do to like help with funding and everything, because most of the funding for musculoskeletal diseases actually comes from the NIAMS.
Mhm.
It says that they should like get more funding from private, like associations and stuff to like help like increase the funding.
Mhm.
Because it can't all come from our
Yeah.
like tax.
Well, the best way to do that is like bringing awareness, which I think this
Yes.
article is doing,
Mhm.
like the fact it's the musculoskeletal, like they're like dead last for the
Mhm.
amount of funding
Yeah,
that comes out of like the total big budget, like that is the bottom. And
Mhm.
it's just like compared to how many people are affected by this, yes, it doesn't seem like as significant because it's like, oh, well, they're not gonna die like in 6 months or
Mhm.
but like it's still just like the quality of life is just I just could not imagine like I don't know
Yeah.
if it was prevented, like if I could think like, oh, this could have been prevented, like instead now I have to live with like a sore back for the rest of my life, relying on painkillers, therapy, like all that stuff is just like unfortunate.
Yeah, I think one good thing about this article is like the way that it repeated its
Mhm.
call to action and its like entire like point of the article, like
Oh,
so
yeah.
many times. It just like continued to say like our findings reveal the need for NIH to reevaluate its funding priorities, particularly in the light of changing health landscape. Like they need the NIH to allocate more funds to musculoskeletal diseases. And it repeated that so many times, which I feel like is really helpful because like other articles, I feel like the point can get lost in
Yeah.
like the evidence
Yeah,
and
it
stuff.
was very like straight up about
Mhm.
what they were trying to do. And I think like research like this with like the private investors and companies and things like that, like the people that made this going like to like, oh, private universities or like private
Mhm.
investors and things like that too could help like
Yeah.
bring some money to like a higher up.
Well, and part of their reasoning too is that whatever the NIH used as like the data of where to put the money, they weren't including the numbers for disabilities. Like they included the hospitalizations and trauma, but they
Mhm.
didn't include the
Like
aspect of
disability.
disability, which
Yeah.
a lot of disability comes from these musculoskeletal diseases because people are just in so much pain that like they can't do things. And I think that would have that's what they mentioned in this article about how they need to incorporate that aspect into their numbers so they can see like how many people it really does affect.
Yeah.
And I remember, I think highlighted, I don't know where it is, but it was saying like the NIH's mission was to like prevent illnesses and like disability. And they're kind of brushing over that disability part with like what they're saying in this article.
Exactly.
It's like they're not really focused on disability, it's more like fatal illnesses or like
Yeah.
things like, because they're kind of like brushing over their own mission,
Yeah.
which I feel like is something to be
Something that's just
pointed
like
out.
really like, they're kind of calling them out here, which is good.
Yeah.
I don't remember seeing something specific. I don't know. I feel like what maybe could have been improved about this article though, for like the outcome of it is maybe to go more in depth about that then.
Yeah.
Because I feel like they did like have a huge chunk of it at the end about like children and like treatment for that. But, and I agree like that's important and that's kind of what that chunk was saying, but it also like, I agree it wasn't as like
Relevant.
much relevant as like the adult.
Well, especially because you
treatment,
see
It affects
the.
more adults and like
yeah.
older age.
Exactly, and you see the wide range of like, the like numbers mostly start at 10 to 74, like majority of that is the adults. And so like the young children, like I think like they are like 10 and unders kind of, and so it's just like they kind of seem out of it. So that big pediatric section, I feel like could have been where they talk about calling them out for the
I think
disabilities.
it's, well, it's like not bad to have because if they have more money, they can, like, if you have a 10-year-old that has like a musculoskeletal.
Yeah,
disease,
that's
You
true.
could prevent like
You can help the
treat them
early
early
onset,
and then
yeah.
they, live their life normally and they can continue to work and it's not like a disability.
Mm,
But I feel like they could have included a little more of like,
about,
how can we,
yeah.
like go to the NIH and fix this?
Yeah, because I think like their whole like goal and point of it was to, they want the NIH to reallocate funding. And that was made very clear, but like to improve maybe the outcome of like people reading this to like know, like the NIH should look at disability, they could have talked more about that. Is like, I think the only thing like that maybe could have been improved about this article.
Yeah, in that aspect, for one of our infographics too, just outlining like the disease prevalence
Yeah.
too, of just
Like
how many
it
people are
really is.
affected by it, and
Definitely.
like even that aspect of children of just like, hey, like they are not as included, but like this,
It's
if we
not-
had more
yeah.
money, like
Mhm.
it
It
could
still
help,
is impacting.
because this can help for
children.
future stuff, which they will grow into having these diseases.
Yeah, there's a lot of good facts in here, like clear facts that we can use for
Statistics and
disease
numbers.
prevalence and even call to action. Like, I feel like the call to action is pretty clear, but it's a little
Yeah.
different because it's not
Yes.
like donate. It's like, no, like,
Raise awareness. Support.
yes, it's more like support
The like cause.
the like cause to like have the NIH reallocate its resources.
Yes.
Because it's not necessarily something like individuals can already like do themselves.
Yeah, we can't like
go
go
into-
to.
Yeah.
Go and just be like, here.
Yeah. It's like a whole like movement to get the NIH to
Like,
reallocate
oh,
its
this is
resources.
affecting a lot of people,
Yeah.
maybe let's look into adding these numbers. like,
Exactly. So I think
reevaluate.
that's something like to explain in the call to action.
That's good.
So,
Like, obviously, we can't do anything.
yeah,
Exactly.
exactly.
Articles like this, like making it more known.
Mhm.
And the infographics, like a
Yeah.
shorter, more condensed version of
Yeah.
what they're saying would be good to like spread the awareness.
Yeah.
And like support towards.
And then for
goal.
funding, we can like
There's so many.
furthermore,
statistics.
like, yeah, it
Yes.
like show like how horrible the funding like previously was. And like the predicted rates versus what they were actually
The
given.
difference between them.
Yes, and then like what they should, we think like
They
the
should
funding
do it,
should
like-
be better distributed.
It's just like
as.
matching the proportions of
Mhm.
funding allocated, so that
Yes.
would be a good topic for there.
Yeah, so
I highlighted a
Three
part,
infographics.
like lack of prioritization for academic
Mm.
innovation too.
Mm-hmm.
So like your new generation of doctors too.
Yeah.
Things like that, putting money towards like academics and actually learning more about that. Cause I feel like you hear a lot more about diseases that like kill versus.
Exactly.
yeah,
back pain
exactly.
or like things like that.
I highlighted this, it says, funding will drive innovation, which will prompt attention to investment on part of pharma biotech and venture capital, bringing effective solutions to the market. So I'm like, they probably don't have that much like biotech, and they're needing like more funding. And needing to go into
Yeah,
it, so that could
it's just
be
small.
something that-
I
yeah.
feel like there's a lot of areas that the
There's a lot
money
of
could be
areas.
like
Spread to
spread.
Yeah,
Mhm.
They
for
just
sure.
don't have enough to actually.
Yeah,
do it.
yeah.
Mhm.
I like that they just like mainly said, basically, they just want it to go to prevention, diagnosis, and treatment. Like, we don't
Easy
have to
call action
worry,
right there,
yeah.
1, 2, 3.
We don't have to
Yes.
worry about like necessarily where specifically, because I don't even know where, and I don't really think they necessarily talked about specifically where in it.
I think it's just an interest
Just
because
like-
there is so
Yeah,
little
just say it
that
would motivate.
there's like
them.
nowhere that you can really put the money because there's just not enough.
Exactly.
Mhm.
So yeah, I think our 3 infographics are gonna be good. Like, we have a lot to
Solid.
talk about.
There's
We
a lot
have
of data.
call to action, disease prevalence, and funding
Funding
distribution. So, sounds good. Yeah.
Yes.
Me too. Yeah.